Hello friends, today we are going to discuss about newly approved topical JAK inhibitors for the management of eczema. In fact, two topical JAK inhibitors have been recently approved in Canada. These include ruxolitinib, which is approved for the management of atopic dermatitis, which is of mild to moderate severity. Moreover, it is also approved for the management of vitiligo. Second medication is delgocitinib, which is approved for the management of moderate to severe type of eczema, which is located on hand. How these two medications work? This ruxolitinib selectively inhibits the enzymatic activity of JAK1 and JAK2. On the other hand, this medication delgocitinib, this is a pan-JAK inhibitor. It inhibits all the members of JAK family, including JAK1, JAK2, JAK3, and TYK2. So, what is atopic dermatitis? Atopic dermatitis is a kind of a chronic relapsing inflammatory skin disease. Means there is a key role of inflammation, and this disease keep on coming again and again. That is why it is called as relapsing. The other name of atopic dermatitis is eczema. In fact, this is one of the most common skin disorder, and about 17% of Canadians are affected due to atopic dermatitis. And coming to pathophysiology, there is an important role of immune system. This immune system gets dysregulated, which leads to disruption of skin barrier. So that is important in the development of atopic dermatitis. Now coming to JAK-STAT signaling pathway. JAK is an enzyme, and the full form of JAK is Janus kinase, and STAT is a protein. The full form of STAT is signal transducer and activator of transcription. And this JAK-STAT signaling is very important in transducing signals of cytokines such as TNF-alpha and interleukins. In fact, these cytokines, they are very important in mediating inflammation in our body. And how these cytokines mediate inflammation? In fact, they mediate inflammation through this JAK-STAT signaling pathway. And now, how these JAK-STAT signaling pathway work? So we will see one by one. So this is how the arrangement is. So let's assume this is an cytokine and this is a cytokine receptor. So you can see that two JAK1 and here JAK, these are located to receptors, cytokine receptors. In fact, to the intracellular sites of cytokine receptors, these JAK are located. This is the interesting condition. So what happens? When this cytokines comes and actually binds with the cytokine receptors, so it brings two receptors together. Means there is a pairing of receptors. You can say dimerization of receptors. So these two receptors come together, and also comes JAK enzymes. They come together. So what is the significance? The significance is that these JAK kinase, this JAK enzyme gets activated. Once this is activated, this kinase will lead to phosphorylation. Phosphorylation of what? Phosphorylation of these intracellular sites of receptors. And then what happens in next step? In step 3, so you can see that once these are phosphorylated, the STAT protein start binding to these phosphorylated sites. Binding of STAT proteins these to these phosphorylated sites. And then what happens? Then binding of STAT to these phosphorylated site is followed by phosphorylation of STAT proteins. You can see these STAT proteins are phosphorylated. Then these phosphorylated STAT proteins tend to move inside the nucleus. They are moving inside. And once they move inside the nucleus, they modulate gene expression. They bind to mRNA, they modulate gene expression. And this modulation of gene expression is followed by inflammatory response. This is how this JAK-STAT signaling transduce the signals of cytokines. And if you inhibit this JAK protein, JAK enzyme, you can inhibit the inflammatory response. So this is what I wanted to discuss in this lecture. So thank you for watching my video. So you can subscribe to my channel for more clinical updates, and you can find us on social media on my website, Instagram, Facebook, and LinkedIn. Thank you once again.